Good morning, everybody. Welcome to CPR for this seminar on towards furthering action research for sanitation worker safety. Just to begin with, I would like to tell you that we, as part of sanitation team in CPR, are working on urban sanitation and are looking at various issues, including the various social issues, women's inclusion, and even the manual scavengers inclusion in the sanitation sector. So let me just tell you a background of this workshop. Basically, it is actually a seminar where we are going to discuss on workers, especially the manual scavengers' safety, and what are the issues related to it. Because we are mostly working, all of us are working in the field. Some of us are the research institutes working with the manual scavengers, taking them along in the policy, discourse and discussing even with the government how to include them. The problem that we all know is that manual scavengers are not even reported, in cities and in the states. Nobody is going, everybody is saying that, there is no manual scavenging here and we are taking care of it. But when we go onto the field, we realize that there are many manual scavengers who need immediate attention. So when the sanitation sector, when we talk about sanitation, it's just not the legal and technical aspects, but also the social aspects, how these people feel included, and despite the this practice of manual scavenging being stopped by the strong legal laws and all those things, but still it is going on. So we are also on the Facebook, so I welcome everybody, those who are here as well as our Facebook audience. And I hand over to Mari for the first panel. We are having two panels basically. First panel is going to discuss, and there are many panelists who have worked on the field and they are still working to know what are the challenges in the field, what are the various discussions that are happening. And in the second panel, which is a shorter panel, we are going to discuss that what are then the ways forward. How, as community of practitioners or researchers, we are going to take this up in the future. So let me invite, without wasting too much time, Mari, who is going to be a panelist. She's a senior visiting fellow with Center for Policy Research, working on urbanization issues. I would request Mari to then call on people. There are some panelists who are on the way. They will be joining us soon, but we can start with those who are present here. Thank you so much. The request is, I've been told by our managers here that everybody who speaks has to speak into the mic, okay? So, okay, Mari, come. Is it fine if I...
I'm very happy to moderate this session, even though I have a very difficult job to do, which is to make sure that all the speakers get equal time to speak, which is each of you is given 10 minutes, because we have an amazing panel with a lot of different interventions that are going to enable us to go further into the subject. And therefore I will not lose too much time, and I invite to speak into the mic, therefore, Mr. Ravikant Joshi, who's the first speaker, and who's team leader in the technical support unit for the National Urban Livelihoods Mission. And I think you're going to talk to us about the work you're doing in various number of cities, including Vadodara. So I am really sorry, but 10 minutes, after 10 minutes, I'll tell you 2-3 minutes before the end in case of. And thanks very much.
Good morning. Thanks to CPR for this opportunity. I will be presenting first little bit about the organization which I represent in ministry, that is Urban Management Center, because they have been working big way in sanitation in last 4-5 years. Before also they were working, but particularly after Swachh Bharat Mission, they have worked a lot. And then I would end this presentation. Of course, presentation is big, giving what we have done, everything, but those slides are in the back. I would summarize what are our learnings from the field. And there I will end. And in the second session, I will narrate, not with the presentation, but what we have been doing in the ministry from National Urban Livelihood Mission. Thank you. This one. UMC started way back 1997 as a part of a ICMA, and it has been working in different fields. Basically, we are not-for-profit organization, and we have been working to bridge the gap between the urban local governments in terms of latest technology, latest trends, policy directives, information and knowledge, resource organizations and solutions, academia and NGOs. Theory of change is basically if policy reforms are implemented, systems are strengthened, and city managers are capacitated and empowered, then cities would become cleaner, livable, productive, and equitable. That is what UMC believes. What we do is, as I said, build association with the local government, advocacy, research and documentation, training and capacity building, various sanitation-related surveys and other surveys, and data visualization and mapping. Coming to urban sanitation, last 3-4 years we have been involved big way in these 4 activities. One is a technical support unit for convergence between NULM and Swachh Bharat Mission, which I head in the ministry, and I will talk about that later on. Then technical support to Mahatma Gandhi's Swachhata Mission in Gujarat as a entire technical support, and we have been managing that entire program for Government of Gujarat for last 3-4 years. Then content development and secretariat support to Swachh Bharat Mission. We established a e-learning platform portal which is there on Swachh Bharat Mission, and there are more than 125 videos. Out of that, 85 videos were prepared by the UMC, and the officers of the ULB take that test and the certificate is issued. So it's a e-learning platform. Similar e-learning platform we will be creating under the NULM, that is National Urban Livelihood Mission, that is going on. And recently we have launched a project in collaboration with or funded by the USAID supported project in Ahmedabad, Porbandar, Jodhpur and Sambalpur, that is moving India toward the sanitation for all. These are the initiatives. One is a community engagement in sanitation, which we are doing. Then supporting policy design and enablers, create model plans, sanitation-based livelihood mainstreaming, and improve current systems to create standard operating procedures. Now, whatever has been UMC's engagement and our team engagement last 1.5 years in ministry with the National Urban Livelihood Mission and Swachh Bharat Mission, these are the learnings, and these points are known to everybody. There is an inadequate enforcement of the Act, because Act provides, but there is no monitoring mechanism which has got created. If you will see where the real deaths are happening, not in formal sector, they are happening mainly private individuals or say communities, societies, apartments or the industries. Even day before yesterday in Baroda district near Bharuch, 4 people died, but it was that industry which employed a private contractor and 4 people lost their life. Now the question is, and you won't hear much, means there are incidences, but where the urban local body, its own formal staff or even a contractor staff, such incidences are not happening. Very rarely they are happening, because some kind of a monitoring does happen over there. All said and done, but in fact I also spent 20 years from 1982 to 2002 in Baroda Municipal Corporation, and though this kind of manhole cleaning and this was happening, because at that time sewer jetting machines and they hadn't come over there, but I don't remember in those 20 years any death of a formal sanitation worker, though the practice was there, because I have worked in the ward office also. So sometime going against the will, I have seen those scenes where you have to commit, and there was no other way around at that time. Not a simple kind of a mechanization was available. Anyway, so big issue is of implementing that law. 3 stages. One, nobody is coming on the board declaring that yes, I have employed that person, because there is a penalty. right or wrong, but people scare, so they don't declare. Government is not coming on the board and declaring because there is a penalty again on that. Only Supreme Court has given exemption into that after when the this appeal was made that this is creating problem. And third thing is those people who are employing them, the informal contractors. The entire industry acts more on an informal basis, and there again issue is of a monitoring. Who is monitoring them? It's an absolutely unregulated industry. There is a recent year policy thrust in toilet constructions and ODF, which is a welcome thing, but there is a need to understand impact on the sanitary workers because there is an increased demand in sanitary workers. In fact, we did the number crunching and it comes that 1.6 million jobs will be required because we have almost put up 5 million individual toilets and 4.5 lakh more community toilets and public toilets. Now you require more people for this to manage because for next 15 years at least, we won't be going for underground sewage network. So we will be on a septic tanks. Earlier there were not this kind of a thing. ODF was there, but now it's a what we can say aggregated ODF because they will have to empty those septic tanks and take it to the field. Then there is an increased workload on existing workers because the formal sector jobs haven't increased. In fact, this Swachh Bharat mission has reached to a kind of an annual, this means survection is going on. Everybody is putting pressure, but there is no increased staff. So what is happening? Existing people have to do a lot of more work. Third is no increase in formal jobs. In fact, it has accentuated informalization of this entire sector. Contract laborers and the outsourcing. So that mode has come and sanitary workers are now getting more and more informally employed. On another spectrum, there is a lack of vocationalization or standardization. This job still is not under the definition of the skilled worker. These all sanitary jobs are unskilled workers because whatever NSDC or skills structure we have created, in that very recently only one QP or a course for waste picker has come, and I will later on tell story. We have developed 4 other QPs, which incidentally day before yesterday got passed through the QRC of the National Skill Development Council, and very soon they will come into force. But then there will be a big challenge. Where are the agencies to train these people? So first, a huge task of TOT will have to be done, and then we will have to create a network of a skill training provider in this field. RPL, that is recognition of prior learning, that has come into force, which will help. But main problem is of a lack of skilling network, lack of skill definition to it, and entire ecosystem of capacity building.
Excuse me, you have only 2 minutes left maximum.
Perfectly fine. Then there are inadequate mechanization effort. First problem is that whatever sanitation system we created over the years was not conducive to the use of machines. And main problem is that the new systems which are getting created, again this point is missed that we are not creating our sanitary systems or infrastructure which is conducive to use big way machines and mechanization of that entire activity. Then there is an inadequate incentive to mechanize. Yes, there are news that Hyderabad has decided to purchase 70 sewer jetting machines and all that, but again it is coming in a formal sector. There are very less incentives or chances of modernizing and mechanizing the micro enterprises and medium enterprises in sanitation. They are dependent, labor intensive, as I said, informal. Their mechanization has to happen because we can't do away with the kind of informal sector is there and the jobs are given to the private provider. Then there is the economic and occupational vulnerability because there is always, if some person says that I won't do the job, there are 5 others to take that job. So poverty is an issue, and then they lack the alternative skill sets. Even if they don't want to continue in that field, getting them into the alternative skill set and then society accepting it, that is the social vulnerability. Accepting them into the main field or other jobs. So, and then these are the external conditions. Within that society also, there are internal compulsions and internal problems. And then we need big way behavioral change effort. We all know that sanitation, half of the problem will go that each of us change our behavior. Then the intensity and density of this issue would go down. And finally, we are discussing and we have gathered today to discuss the issue of limited action-based research. Thank you. And I will leave with this last slide. Entire this ecosystem we have to look into, wherein employer and financiers, then regulatory framework, enablers, and the policy frameworks. This is a detailed one. It will be with you, but we have structured this, which almost try to put in everything which need to be addressed at one go, in a holistic manner, not in piecemeal. Thank you.
Thank you very much. I think you've set up the scene very well for the discussion today, raising all the questions we will, I think, go deeper into as the day goes along. And I think next is Raj Bhushan Roy. Okay, so then we move to Nirat Bhatnagar. Yeah? Yeah, I think you have to. Otherwise, you can't be filmed. So I think Nirat is working with Dahlberg's Delhi office, and I think what you're going to do is to present a typology of sanitation work based on the long work, I think the large work you've been doing. Thank you.
While this thing gets set up, fairly quick introduction to Dahlberg. I don't know how many of you are familiar with Dahlberg? Raise hands. Okay. It's a bunch of people. So we're a global mission-driven consulting firm. We focus on multiple practice areas. Sanitation is a big focus area for us globally. I lead that practice for us, and we've been doing a lot of work in sanitation over the years in Asia, in Africa, in India. Over the last 3 or 4 years, as we engaged on different aspects of sanitation in India, including, let's say, business models, financing, and so on and so forth, also all kinds of innovations, what became fairly clear to us was that one sort of blind spot that existed was sanitation workers. So we sort of proactively approached the Gates Foundation, with whom we do a lot of work, and we said that why don't we really try and unpack this problem a little bit and put some structure around this, understand who these people are, what challenges do they face, what's the life cycle that they navigate, and what kind of solutions across hardware, behavior, policy, financing would actually solve for it. Because in our sort of perspective, till that point in time, sanitation workers had been approached primarily through a human rights sort of angle. There was some conflation of different types of workers into this, blanket definition or this blanket phrase called manual scavengers. So we wanted to bring some nuance into this, and we carried out a 4 to 5 month study sometime last year. And really the study had 2 parts. The first part was understanding this problem, mapping the ecosystem, mapping different types of work, and then going really deep into those kinds of workers, their lives. It was a mix of strategy, it was a mix of human-centered design, research on the field, and so on and so forth. So that was part 1, which was really understanding challenges. Part 2 then went into solutioning. So what kind of solutions across policy, financing, hardware, behavior would solve for some of these problems. So both of these things came together, and we helped develop a strategy at a city level, and then a strategy at the national level for taking these things forward. Also, we budgeted solutions. So we identified about 27 macro solutions, then prioritized about 15 of those, and then we put numbers against those, how much would it actually cost to implement those solutions at scale across India, and then also what pilot variants of those solutions would cost. That then led us to a second phase, which is really implementing some of those pilots, innovation pilots. And actually, there's a Dahlberg team. So Anahita, my colleague who manages knowledge at Dahlberg for sanitation, and then Venkat, who's been sort of based in Hyderabad for the last 3 or 4 months, and he's helping ASCII and Telangana, sort of the city government of Warangal, implement some of those pilots. So this presentation really doesn't, I won't spend too much time on the nuts and bolts of the insights, because there's really lots of ground to cover. I don't know how many of you have actually read the full study. Have you downloaded the study and read the study? So it's all available online. There is a few USB drives we've brought, which we can leave with you. So this is a USB drive which actually contains a bunch of reports from this project, different phases. It's also available online, so it's sanitationworkers.org. You can just go there, find this and download it. What we also did for the World Water Week was to put together this deck of insight cards, which actually is a very nice way of thinking about this in a team, and you can actually you can brainstorm about it together, right? So okay, so this thing looks like it's set up. So why don't we just jump into it? Keeping in mind that we only have 10 minutes, what we try to do is to 6 now. Okay, yeah, okay. Okay, great. Okay, excellent. So let's say the clock has just reset very kindly. So and then we have. So this is just a very quick overview. This is not the full study. The full study that you'll see is about 200 slides, lots of data, lots of charts and graphs. So really do encourage you to go there and read it. Like I said, look, there's been incredible progress on sanitation. Hardware, financing, the focus on IEC, all of those have improved dramatically in the last, I would say, 10 years. The last 4 years, maybe more acutely. However, sanitation workers have remained on the fringes. I mean, there has been dialogue. I mean, many very credible groups headed by people like Mr. Wilson. They've sort of been at this problem. They've been advocating very strongly. But I would say that still has been somewhat of a fringe narrative with some spikes. Right? It really hasn't been front and center, the sanitation worker problem. And I think the best way of starting this is to really understand that there is, it's not a homogeneous word, right? Sanitation workers are of different kinds. We call, I mean, it's quite frustrating, honestly, to hear this word called manual scavengers. Almost everyone uses the word manual scavenger, media uses it, even in the academic circles, even the development community, the word that gets used is manual scavengers. And frankly, that's a very obsolete word. If you look at the roots of that word, I mean, it goes back a long way and it captures only one particular aspect of sanitation work, which was the only aspect when that word was coined, right? You only had dry latrines a few decades ago, and that's the reason that word was coined. So we want to really understand who are these people and how are different kinds of sanitation work.
Neeraj, can I request you to please sit because it's getting video recorded and they're not able to record you.
Okay.
Along with the rest
So so we mapped different kinds of sanitation work across the value chain, and we found that there are 9 types of work that actually takes place. So these are not 9 types of workers. This is 9 types of work that takes place, and some different types of people do this combination of work, right? So on the interface side, for instance, and everyone's familiar with the sanitation value chain, I imagine, right? Show of hands. Everyone knows the sanitation value chain? Okay, great. So on the interface, you've got people who deal with insanitary latrines, so collect waste from the latrine, which is what manual scavenging was traditionally understood as. Then you have people who clean individual toilets, go house by house, clean the front end, clean the toilet itself. You have people who clean community toilets and public toilets, mostly in cities. You have people who clean school toilets. That's a very special cadre, people who are employed either full-time or part-time. Both in urban and rural areas, and then finally you've got people who clean railway tracks. Again, a different cadre, hired directly by the railways or through subcontractors. Then you've got, coming to the containment and transport stage, you've got people who clean pits in rural areas, often manually, people who clean drains, often deep drains in cities, etc. Again, you've got septic tank cleaners and trucks, of which there's a lot of sort of mention in the news these days. You've got people who get inside sewer networks and clean those. Again, a lot of mention there. Then coming to treatment, increasingly you have people cleaning treatment plants, both large and small, so FSTPs, large sewage treatment plants and so on. So that's a typology. And we did an estimate. So we looked at all the different numbers that have been reported. Now, so 2 things must be kept in mind before understanding what the Dahlberg model really did. Number 1, all of these estimates talked about only 1 or 2 types of workers, right? So, the official number on how many manual scavengers was there. Some states have reported it. There's a national number that was there. We spoke with ministries and so on and so forth. But that, number 1, underreported. I mean, again, there was a lot of. If you were to talk to people honestly, they would say that it is an underreported number, and it did not cover all of these 9 types of work. So what we did was, we imagined that the system is in steady state right now. So whatever waste is getting created, it's not piling up somewhere. So and we did almost like a time and motion study of how much time would it take, how many full-time employees would it take to get the system into steady state. So we came up with a number that way. And then we triangulated that through a bottom-up approach of going to cities. We looked at cities like Warangal, how many workers do they have, and what the ratio is of the workers to the population of the city. So the numbers sort of gelled well, and we sort of took a fairly conservative lens. And the number we land at is really about 2 million people who are working in hazardous settings, and about 5 million overall. A very large fraction of these 5 million people, about more than half of them, are just domestic workers, people who clean toilets in the households, both in urban areas and in rural areas. About 2.5 million people are of the other types. So all your pit workers, drain cleaners, septic tanks, sewer workers, railway tracks, all of those sum up to about 2.5 million. And split, I think, slightly towards the rural areas. And again, the detailed report has a lot of graphs. You can see the splits by different types of work. You can see the gender split. You can see the urban and rural split. Then for each of these different types of work, we actually looked at where does risk originate from. So we were trying to solve for two things. Number one, just the risk, the health risk, etc. And number two, the livelihood risk, right? So where does risk really originate from? So we did like a process study of the different steps in that particular type of work, and where is risk coming from. We profiled people, this is for that matter, sewer workers. So we looked at who are these people who are doing just sewer cleaning, what is the education, what's the sort of livelihood, social and health status, etc. And we found that there was heterogeneity, so different types of people do these 9 types of work. And they face slightly heterogeneous risks of these three kinds. And this is just the same thing for septic tanks and railway tracks and so on. So the full report has all of this. Then we went to, and this is a subtle distinction, but it's an important one. So you saw the 9 types of work. Then we, through interviews with different types of people and lots of discussions with them, we tried to abstract and create personas of the type of people who work in this setting. And we found that there are 6 very distinct type of people who work in this field across those 9 works. One are people who inherit that work from their family. Let's say a woman in a family, her husband is in this work, something happens to the husband, and she, or maybe there's need to augment family income, and she ends up becoming inheritor. There's some, let's say, youth who really has aspiration, wants to do something, but again, bound by family tradition, they need to augment income. There are people who are sort of thinking of these as like transient gigs almost, if you will, on their way to so many of these young youth in, let's say, community toilets across India. And then the last column is really the permanent sewer workers. These are the people who actually have a contract, an employment contract with the city, ULB, and that changes everything. So they are relatively much better off. Again, this is just a very superficial view. The report has a lot more detail. Mapped them on many of these dimensions, and then some insights. So then we abstracted insights around 4 different, I would say, drivers of this problem: behavioral sort of drivers, social drivers, hardware drivers, and governance drivers. And I'm just going to sort of walk you through very quickly through one or two of each of these kinds. Number one, for instance, a behavioral sort of insight is B2, which is workers feel invisible and often operate without formal contracts and are unaware of the terms of employment, right? So either direct contracts with the city or indirect contracts through a subcontractor, they are not aware of what these terms really are, and hence they can't really negotiate. There are very little sort of penalty or safety clauses built in. Even if there are, they're rarely, if ever, enforced. Yeah. Similarly, there's a bunch of social stuff. There's infrastructure. So just to reiterate, I think what Ravi was talking about. Machines are really not designed for the full range of use cases. I mean, you have just 2 or 3 mechanical functions. You have a forward function which is jetting. You have a reverse function which is vacuum, and those simply aren't enough to solve for all the problems that happen. Let's say in sewer networks, form factors are a big problem. They're very large, can't go into narrow places. And there's a bunch of governance stuff. Low budgets, lack of recognition, budget pressures on ULBs. Our ULBs are really poor. They actually don't want to inflate their budgets and have people. Then we developed a bunch of solutions. If you think of a life cycle of the sewer worker, or sanitation worker entry on the job progression, we developed about 16 ideas, so ranging from a tech-enabled sanitation worker ID system or a registry, which would then be linked to, let's say, Aadhaar and be linked to benefits, all the way to, let's say, a sanitation worker sandbox and an innovation environment which would help, prototype hardware, develop the right kind of machines, do things like, tech-enabled issue resolution mechanisms so that, let's say, benefits accrue to them in time, etc. Entrepreneurship, breaking the family legacy scholarship schemes, and so on and so forth. But also some cross-cutting stuff. Sorry, I forgot to mention just hardware design. I think reimagining what city-level hardware should be, or even rural hardware should be. Some of these are low-hanging fruit. Some of these are expensive things. So we then, and there's some cross-cutting stuff. Campaigning, budgeting, institutional strengthening, and so on and so forth. Out of this list, we identified pilots that could be done easily to proof of concept. 4 of them were identified. Some behavior change programming for safety, for sanitation workers, an ID system, contract design, a more effective contract, and also a more visual contract so that people actually get it, right? So a lot of these are not, a lot of these people are not literate, so cognition becomes a challenge, and hence visual sort of contracts that solve for that problem was an idea. And then finally, entrepreneurship. There's some pieces that have been done, but a lot more can be done. So this is what we've been up to. We've been sort of doing stuff with NIUA and with a city in Telangana, Warangal, along with ASCII. I think the next step is to actually just become, number one, far more ambitious about the kind of innovations you can drive, and this discussions we're having with a bunch of people. And also, I think this convening is really, really timely because there are many open questions that still remain. There is definitely a action research agenda that's very rich and can drive. I would just encourage widening the research sort of frame. Right now, it's been very simplistic. It's been one lens that's really dominated. I think there's room for a bunch of research, and this is a great stuff. Thanks. Yeah, and we'll leave some of these to the side. You can pick it up. And Anahita and Venkat are there. So I'll have to take your leave, but I think Anahita will be here in the panel discussion, and any questions you guys might have, more than happy.
Thanks very much. It was very, very interesting. I already noted a contradiction between the first 2 presentations, because you estimate, I think, a decline of number of workers by 2022, and Mr. Ravi... Okay, because Mr. Joshi was saying we will need so many more workers, so I don't know if this is can come up in the discussion, but that might be a point of discussion. So now I would like to invite Raj Bhushan Roy. Who is from WaterAid, who's been involved in the sanitation sector for a very long time. And I think Mr. Roy will be talking much more about the social questions around the question of discrimination, exclusion, and deprivation, if I'm right. Okay. And if you can also try to keep it. Yeah, yes, I think I will put pressure on the 3 CPR fellows who will have to keep their 10 minutes. I give you a little bit more like previous presenters. Thanks very much.
Okay. Good morning, everyone. WaterAid has been looking into sanitation workers vis-a-vis manual scavengers through this European Convention project, and we are in implementation with partners as Safai Kramchari Andolan, that is the Association for Rural and Urban Needy, and Center for Equity Studies. Okay. So, as per the new definition of the 2013 Act, we already see what manual scavenging is. Predominantly, we find it as a caste and descent-based occupation. Definitely construed in the misconceptions of the socio-cultural ideological basis. And we have tried to look into the different interventions of into manual scavenging, beginning from 1933 with the prohibitory laws, as well as the 1993 law, and thereafter finally the 2013 Act, Now, after the 1993 law, the third and the fourth parliamentary committee report had already said that the act or the law has not been working, and subsequently, after a lot of activism and by the people who were into defending manual scavenging, this new law of 2013 came into place. There are the key features of the law, but even now, when we see and try to implement the project on the ground, we see there is a clear misconception, even amongst the local bodies, where they do not treat manual scavengers or sanitation workers within the ambit of the law, and so far they treat only those who are involved in cleaning the human excreta as manual scavengers. Even with the presence of this 2013 Act, we see a lot of scope of other laws which comes into play, including the labor laws, the Land Acquisition Act, the Child Labor Prohibition Act. With the recent deaths, of course, there has been a lot of hues and cries about the sewer deaths, and for the first time, even the National Safai Karmchari Commission, they took cognizance of the matter, and they have reported official data of like how many deaths actually is taking place. There has been health hazards amongst the sanitation workers. While the SECC data 2011 states that there is almost 180,000 manual scavengers, but interestingly, even 2002-2003 Ministry of Social Justice and Empowerment data says that it's around 676,000. So there is again a discrepancy in calculating or counting the manual scavengers, because most of the survey which is happening even as of now, the Interministerial Commission survey, they're counting the urban sanitation workers. So a large chunk of a rural sanitation worker gets missed out. The project which we hold has a strong focus amongst the women, because it is clearly it has been seen that 95% of the women who are involved in sanitation work or manual scavenging, especially in the dry-in sanitary latrines, and there has been claims that the government has rehabilitated them, but the ground situation is definitely much different. The rehabilitation, what the government states, there is even in the last Supreme Court verdict, there was a clear differentiation between liberation and rehabilitation. The new law was designed in a way to kind of liberate and not just rehabilitate. But even the rehabilitation part, if you look into it shows that even if you look at the last allocation of last 5 years, you can see that in last 4 years there has been no allocation, and in 13-14 only 55 crores has been allocated. There has been even in the National Urban Sanitation Policy, it has been greatly missed out. The Swachh Bharat mission, we were getting traces of like how it is adding to the manual scavengers in the rural areas as well as the urban areas. While this assumption that the different national policies and programs will lead to subsequent eradication of manual scavenging, and I would emphasize also not just destroying of all the sanitary latrines, but also the so much hyped of the use of protective gears and equipments. Very lately, I mean last week itself, we were in conversation with some of the local bodies, where off the records they really said that we have these provision of giving protective gears and this thing, but it's hardly being used. So the idea of sanitation work without manual handling of human excreta looks very dismal. So water aid, according to its country strategy, along with the EIDHR grant, we are looking into this project. This is a completely community-led action and a women-led project where it is vetted in SDG 16 and 10, and the overall objective is that this community largely misses upon the social capital. So we try to create that and empower them to a level where they can advocate for their rights and justice, and organize and mobilize the women community so that they can lead their own advocacy. It has a research component, two specific research. One is that we take a review of the situation of the Act, like how far it has actually been implemented and benefited the communities, as well as we take a study which is specifically focused on this situation of the insanitary dry latrines. We have the project is so designed that focusing on the areas most affected by the existence of the insanitary dry latrines, and which is why we have focused in 4 states, 12 districts, and 36 habitations, which we call bastis, and the focus is definitely more on the women. Definitely, large number of institutions are at the crossroads where we have to work closely with, including the new Niti Aayog and the NSKFDC. So one is that these women who are being the target population, we are trying to empower them so that they take the advocacy not just at the national level and the state level, but also at the international level with the United Nations. So far, since it's a new project, we have just completed our baseline and we are analyzing the numbers and the data, while a range of advocacy efforts have been started in the states, and we expect that this project would also not just look into the situation of the implementation of the Act and the community, but would also look into other prospects of livelihood, and other prospects would not mean necessarily sanitation work, but other forms of livelihood. And we expect that with all the findings that we come through these studies, we share it with the state, with the government, so that they can identify some of the bottlenecks of what has not worked and how it should work. And through this, as we said, that we are also advocating it with the United Nations. So we take this matter in the high-level political forum in the coming year. So that is it. Thanks.
Thank you very much. Okay, you've not even used the 2-3 minutes more I gave you, so I'm not giving them to you. Manish, who is next, and who is going to, I think, now talk about, I think the program is fantastic in how we progress from one element to another, and you are going to speak, I think, mainly about the law and its content, right? Yeah. So 10 minutes. Thank you.
Right, I think we've had some issue with audio on the Facebook Live, but I hope to all of you who are listening on Facebook Live, you can hear now. Please leave us comments on the stream if you're unable to hear. So, so I think the speakers before me have spoken about a wide range of issues. I'm going to start with something that Neeraj said at the beginning of his presentation about how the word manual scavenging is used very broadly to mean a wide range, to cover a wide range of activities. And then from there, to go to what the law actually says manual scavenging is, and what are the other categories of work that it recognizes in what form. And to start from that, how did we get here? This was the original definition in the 1993 Act, which has been referred to in previous presentations. The 1993 Act to prohibit manual scavenging and dry latrines. As you'll see, so the keywords here are a person carrying human excreta, or what was commonly referred to as head load carriers, right? Head load or night soil carriers. People would carry them on their head. At that point of time, the practice of dry latrines was fairly widely prevalent, and where latrines were not flushed by water, but the night soil after each use had to be cleaned out manually by a person. The Act in 1993 essentially focused on pushing people from dry latrines to water seal latrines. So the idea was to demolish all dry latrines and convert them into water seal latrines. So the definition of water seal latrine is here, but the essence of it is that where human excreta is flushed by water as opposed to being cleaned by a human being. And dry latrine means any other latrine other than these. The Act, of course, as most of us working in the space know, had very poor implementation, even with all of these provisions. There was a long movement and a struggle involving activism at the Supreme Court, with the governments, in Parliament, and various other bodies. Eventually, 20 years later, the government enacted another law called the Prohibition of Manual Scavenging Act, which is in 2013, which is the currently operational law. And just to and this is the transition that's actually happened from 1993 to 2013, right? So when you look at the earlier definition of just carrying human excreta, the law broadens that into carrying, cleaning, disposing, handling excreta, and you'll notice that the term dry latrine changes to insanitary latrine. And it also covers spaces beyond the latrine itself, because by this point it recognized that even water flush latrines are do not necessarily by themselves eliminate manual scavenging, because the waste has to still go somewhere else. And therefore, it also covers open drains, pits into which human excreta is disposed of, railway tracks, and any other premises. The key at the end also is that so the essence of this is that any handling of human waste matter before it is fully decomposed in any of these spaces constitutes manual scavenging. What is fully decomposed is also defined in the rules. And now we see how things change from dry wet to the insanitary sanitary situation. So in place of dry latrines, we have insanitary latrines, which is basically one that requires human excreta to be cleaned or handled manually before the excreta fully decomposes, right? So you will see that the two definitions are closely linked. And a sanitary latrine, I think there's some issue with the projection, but a sanitary latrine is one which is not an insanitary latrine. So anything which is not covered in this definition. You will also notice the proviso, and I think Nirat also mentioned this in his presentation, railways as an important site of manual scavenging. The railways is one of the largest employers of people who engage in unsafe handling of human waste, right? Because of the way railway toilets are designed, you will obviously realize that railway toilets would fit in the top definition. However, an exception has been created stating that latrines in railway coaches, when cleaned with the help of such devices and using such protective gear as notified, are not insanitary latrines. The central government has issued a notification under this section where the protective gear for cleaning railway latrines are basically the following: uniform with apron, a face mask, gloves and boots, and the devices that are to be used are long-handled brooms. Right, so that's the extent of protection that railway workers have with regard to manual waste. There is ongoing litigation currently in the Delhi High Court about the safety of railway workers involved in this, and I think that's an important area to also think about when looking at this issue. What the 2013 Act also does is it recognizes new spaces. So in the earlier paradigm of dry latrines, it did not recognize any space beyond the toilet itself. The law now recognizes that waste requires to be handled even beyond the space of the latrine itself, right? So therefore, it also recognizes what septic tanks and sewers are. Yeah, and this is the legal definition, and I think maybe during the discussion, technical experts can comment on how this squares off with what the technical definition of a septic tank is. And the official definition of decomposition at the end of this states that human excreta shall be treated as fully decomposed when it becomes stable material with no unpleasant smell, right? So, I mean, the smell test in a way. If it doesn't smell, then it's no longer excreta. So, and the final definition that I look at is what is called hazardous cleaning. This definition comes in relation to septic tanks and sewers. So the law recognizes that septic tanks and sewers also need cleaning, and cleaning of septic tanks and sewers is a hazardous exercise. And therefore, it creates this slightly convoluted definition, which essentially means that if a septic tank or a sewer is cleaned without protective equipment and without following the process that is prescribed for safe cleaning, then then such cleaning is called hazardous cleaning, right? So it's defined in sort of the reverse way. So to imagine the counterpart of hazardous cleaning is safe cleaning. So sewers are safely cleaned when they are cleaned with protective equipment and following the prescribed process. Anything else is hazardous cleaning. This process is, I'll come to in some detail subsequently. So in sum, what do we have right now, right? So we have insanitary latrines, which are prohibited under the Act, and all insanitary latrines are supposed to be converted to sanitary ones. The practice of manual scavenging, as defined as we went through that definition earlier, is also prohibited. Sanitary latrines, sewers, and septic tanks are regulated through a prescribed process, and we'll come to that in a bit. Hazardous cleaning, which is cleaning other than through this regulated process, is also prohibited, right? So, so the first of these regulations is the push for mechanization. So under Section 33 of the Act, it places an obligation on all local authorities to use appropriate technological appliances for cleaning of sewers and septic tanks for the purpose of eliminating the manual handling of excreta. And further, in case of sewers, manual cleaning of sewers is restricted in five specified circumstances. Those are on the slide. But the most interesting of these is the fifth one, which is basically any circumstance when it is absolutely necessary, where the local authority has to certify in writing that it is impossible to clean this mechanically, and therefore manual cleaning has to be permitted. There is a list of safety precautions which I won't go into in detail. There are 44 pieces of safety equipment. There's a very detailed 27-step process, and I'm wondering if some of this finds its way into training and other things that Mr. Ravikant discussed earlier. Violation of any of these conditions is hazardous cleaning. What are the consequences? So this is my last bit. There's a higher penalty for hazardous cleaning than for manual scavenging, which is under the Act, which is based on the recognition that unlike manual scavenging, hazardous cleaning also has a possibility of causing death. However, it is an offense to send someone into a sewer without protective equipment, even if no death or injury is caused. Right? So the very act of sending someone into a sewer constitutes an offense with a punishment of up to 2 years. It's a cognizable offense. Registration of an FIR is mandatory, and depending on the and as we all know, this occupation is closely linked to caste, and if the victim belongs to a scheduled caste or a scheduled tribe, the provisions of the SC/ST Prevention of Atrocities Act also become applicable, in which case the punishment is more stringent and there is no provision of anticipatory bail for the offense. I think these provisions, the compensation and rehabilitation part has been discussed earlier, and I think Devashish will discuss the rehabilitation scheme in some more detail. The last bit is on institutional mechanisms. So there is the primary responsibility for implementation of the Act lies with the district magistrate in every district. The district magistrate also heads a vigilance committee, which has the SP and representation from ULBs, etc., which is supposed to monitor the registration of offences and their investigation and prosecution. part, I think it remains to be seen how many of these committees are actually active in various districts and carrying out their functions. And my last slide, so a colleague of mine pulled out some data from the census. On the left side are categories that the census uses. So as we see, as of 2011, less than half the total households had in-house latrines, and this is what the Swachh Bharat mission was targeting. But it's interesting to also see that of houses with latrines, there is a significant number that's not connected to either sewers or septic tanks, and even within those, sewers are a minority. Rural and smaller urban areas are primarily covered by septic tanks, and even for bigger urban areas, sewer coverage is limited. Even in the 10 biggest cities in this country, only 71% of households are covered by sewers, right? That's a huge number that is not covered by sewers. And the applicability of these provisions and the regulation of septic tanks is, I think, going to be an important thrust of this moving forward.
Okay. Thank you, Manish. It was very clear. So we move to Tripti, also from CPR. And I think Tripti is going to present the work that she's conducted in Ekta Vihar, which is a neighborhood of Delhi, on sanitation work. Okay, thank you, Tripti.
Hi. So I'm gonna basically talk about the sanitation work, drawing from my case study in Ekta Vihar, and also contextualize it by review. So we had conducted a literature review where we had extensively looked at how manual scavenging has been understood within the literature, in the policy literature, in the grey literature, in the committee reports, in the academic literature. So I'm going to draw on findings from that as well. And this work was undertaken with my two former colleagues, Mahima Malik and Kimberly Narona. So it's a collaborative work. So sanitation has been part of the first 5-year plan, and subsequently so on. It has been part of all 5-year plans from then on. In 1949, a Scavengers Living Condition Inquiry Committee was set up. This was headed by the Bave Commission, and the recommendation that it put forward aimed to improve the condition of work and also fix the minimum wages. So it inquired into the living condition of the sanitation workers. Then in 1950s, the Backward Classes Commission was set up, and then Scavenging Condition Inquiry Committee was set up. So in 1950s and 60s, there was a focus towards understanding what are the different situations, working conditions, and socio-economic profiles of these sanitation workers. In 1960s, there was a move towards understanding the customary rights of the sanitation workers. So here we see that in all these reports, there's a So in 1965, when the Committee on Customary Rights came in, it explored what is meant by customary rights. So they figured out that it's rooted in hereditary occupation, and sanitation work that way is rooted deeply in caste. In 1970s and 80s, later on, there was a move towards schemes that came into being. So integrated low-cost sanitation schemes that came into place, and these schemes pushed towards building of twin pit toilets and provided support especially to the urban poor. It was specifically only for the urban poor, and they looked at giving money to build toilets in these areas. And after this, the 1993 Act came in, and I'm not going to talk more on those since they've already been covered by Manish and Raj. So sanitation work has been differently understood, but it's deeply entrenched in the caste system, and these castes are used interchangeably with the caste name. So the sanitation work itself has been used to refer to sanitation workers. So, for instance, in West Bengal, Hari, Hadi, Buffer, Dome, these are the terms that are used to refer to sanitation workers. Similarly, in Uttar Pradesh, Valmiki, Dhanuk, Dome, Mehtar, these are some of the terms that are used. And similarly, even Bhangi is used as an occupational descriptive term for manual scavengers. This term is also applied to Muslim, Sikhs, Neoclassic Buddhists. So it goes beyond just one particular religion and is used as an occupational description for the entire workforce. Manual scavengers are from groups customarily relegated to the bottom hierarchy and confined to livelihood tasks, and this is something that we find across literature. Their caste designated occupation reinforces the social stigma that they are unclean and untouchable. Discrimination in their everyday social interaction is something that they face in their day-to-day life. For example, in one of the study that was recently published by Shivastav in 2014, he found that he mentions about this that all the neighbors objected to manual scavengers' usage of water from open drains to wash buckets and pans used to collect fecal matter, but they encouraged young children to defecate in the same open drain. So there was a bit of double standards in a way almost, where kids were encouraged to defecate in the open drain, but they were manual scavengers or people who service dry latrines were told not to even use that open drain water to wash their pans. The term Bhangi is used an occupational descriptive term for manual scavengers. This term is applied also to Muslims, Sikh, like I mentioned. The working conditions of the manual scavengers is initially, especially traditionally, constituted of servicing dry latrines. But later on, there's a shift now that we see towards cleaning of sewers and septic tank, which is also referred as hazardous cleaning. So there's that ambiguity, especially in the literature, where these two terms are interchangeably used, that is manual scavenging and hazardous cleaning. There's also been data figures to state that 95% of women are manual scavengers, wherein it's also viewed in a traditional sense where they used to service dry latrines. The dominant narrative that seems to come out in the literature is that manual scavenging was a customary right, and it also provided the manual scavenger or the sanitation worker a right to depend on that livelihood. It provided a secured livelihood in a way. So this is something that's coming out very extensively in the literature. But the Badayu study that was, I think, conducted by WaterAid also reveals that this is common argument put forward both by officials and elites, but this argument, however, is rebuffed by the Balmikis and also the sanitation workers, who say that this is an easy way out, but in reality, we have to face a lot of issues while on the field and also in the place where they live. This is something that's also coming out in from our study, which I'll be discussing further. Sure. So, we had our field site was Ekta Vihar, where we had extensively carried out our study. It is an unauthorized colony in southeast Delhi. It has contested boundary lines. It's non-sewage settlement. There are no community toilet or public toilet in the settlement, and also most of the households are connected to septic tanks or what they call soktas. This is the field site. So the black line that cuts across the slide is basically the municipal boundary. So that means these gully 1 and 2 and 3, most of it lie outside the municipal boundary. So in gully 1, none of the Safai Karamcharis from the NCD come to service it. So it's the household who actually carry out the cleaning processes. And same is the case in part of gully 2 and some part of Gully 3. So in this particular settlement, the recruitment drive for sanitation workers that was conducted was carried out in 1996, 2006 and 2014, and these largely are in congruence with the outbreak of a plague. So they were really in response to the health crisis in the settlement. This settlement is also considered as an illegal settlement by a lot of people colloquially, also by workers who there are less workers designated to clean these settlements. Consequently, each Safai Karamchari has to shoulder more workload in these settlements. Sanitation inspector reported that Karamcharis in this region are overworked. So it's not only just the sanitation workers' argument, but even the sanitation inspector agrees to that. Workers clean the nali, which has latrine water. So as most of the settlement doesn't have sewer network, and it's collected by septic tank. So and a lot of outflow from the septic tank is released directly into the open drain. So consequently, it has latrine water, which has to be continuously cleaned. So uniforms that the workers receive are also not regular. In fact, the sanitation workers reported that it's been 3 years since they received the uniform, and also that usually a one-size uniform is given. But we know that one-size-fits-all strategy doesn't work, especially even with the uniform. I mean, one of the workers actually said that, what will I do with a 7 feet tall uniform, a uniform that would fit like a 7 feet tall person. The social discrimination that they face at their workplace. For instance, residents do not offer them water, even if they need water and they request for it. In fact, one of the sanitation workers mentioned that they are given from water from far, even if they are given, and that too in a broken mug. And residents avoid touching them, and they have to inhabit places that are exclusionary in a way, near a press, near a place near where where a person irons, or near a mochi, or in secluded portions of a park. We also conducted interviews with the households, and some of the, especially in the Gully 1, there we found that households also clean the drain themselves. Since most part of this gully is not serviced by the sanitation workers, so a lot of this work is also done by the household, and they themselves were saying that they do not want to do it. Also, there's that social discrimination that they feel when they do it, and they take on elaborate procedures of taking a bath, and only then do they get on with their cooking. Women residents often use bare hands to remove the content of the open drain using tasla. So some of the tools that households themselves have started keeping in their houses is tasla, mud guards. They use mud guard as a scraper. Then they use seek jhadu to broom the street, kolchi. Daily residents wash the front of their house as part of their everyday chore. And in this way, the entire gully is clean. So every household sort of carries out this cleaning process. They clean the front of their house every day, and also the drain along their house, which is many times also covered by this high plinth. And in this way, the whole gully is eventually clean. Although they perform similar work, but it was evident in our field work that social discrimination, especially pertaining to the work of sanitation workers, continues. Safai Karamcharis are referred as Jamadars and Bhangis. So these are some of the key findings from the study, and these are also, so we are in the process of finishing our report, but these are some of the main findings and key takeaways from the study of Ekta Vihar that we have done so far. Thanks.
Thank you very much. And the state of Haryana doesn't at all intervene in these galleys, the ones which are outside the border.
This lies more so on the no man's land, where the Delhi government doesn't want to take ownership,
Right.
and the settlement itself is covered by a wastewater pond. So as a result of that, the state of Haryana doesn't also intervene, nor does the state of Delhi.
Okay.
There's water
Yeah.
body all around it.
Okay, it's very interesting. So, next is, I think, Devashish, who's also from CPR and who is from the Accountability Initiative. And I think you're going to talk about the assessment of the self-employment scheme, right, for rehabilitation of manual scavengers. So you also have 14 minutes, like everybody actually had given.
No, it's just that unfortunately the font seems to have gone haywire.
Oh.
Yeah, there's some error with.
Oh, okay.
Chalo, koi baat nahi, it's fine. Not really that important. If I do it on this, it'll probably pop up in the same way.
Right.
I could open my system, but that'll probably eat away 5 minutes.
I think it's
Except if you want to
it's
finish.
legible, I think.
Yeah, I
Okay,
think
fair enough.
if you put it in slide format, I think we can. No?
Yeah.
Sounds okay.
More or less, I can
Yeah.
read out whatever.
Yeah. Okay. Right.
It's legible.
Yeah.
Yeah, that works.
So in many ways, I think it's useful to come last because I can draw on some things that have been spoken before. Oh, there is one more. Well, I've gone through enough of them to steal from. So I think we're good. A couple of points that I think were fairly salient in this whole affair were to talk about firstly the fact that laws have been passed to prevent discrimination since perhaps the 50s, but manual scavenging as a problem emerged really on the public forum only in the 90s. By the time that they actually started these programs, and there was this NSLRS, and there was this SRMS Part 1, and then there's SRMS Part 2, and so forth, it almost seems like they've been trying to understand what to do with these people, but they can't really figure it out, which I can understand. So what is SRMS? And I'm going to talk about this only in the context of what is SRMS right now, which is to say what it became after 2014, after the law was amended in 2013. So two things which sort of matter. One is that the new SRMS or the current SRMS really looks at the broader definition of manual scavenging, which is in the new Act. So it is not only pertinent to people who clean dry latrines, but even other sort of whoever falls within the gambit of that definition, including people who perhaps clean single pits and septic tanks and so forth without protective gear. There are three ways in which well, actually four, but they kind of be clubbed into three. There are 3 or 4 mechanisms by which this particular scheme tries to bring manual scavengers out of their profession. One is this so-called one-time cash assistance, which is about 40,000 rupees, which is given to a person in installments over 7 months. So it's not given as a lump sum, but in installments of about 3,000 rupees each. 40,000, whether or not it is sufficient, one doesn't know, but one assumes that it is a stopgap or a sort of part of the process rather than the rehabilitation package itself. The second, of course, is loans for self-employment projects. So for people who are willing to or desirous of setting up projects for themselves, they're given a loan up to about 10 lakhs with some sort of changes for women. They're linked to a certain credit link capital subsidy, which is to say that the interest is subsidized, the capital, the return of the principal amount is subsidized, and the subsidy is higher if the project relates to sanitation and so forth. And then there's of course the skills training, which comes along with a bit of a stipend. The skills training is typically for the dependents of the manual scavenging family who don't necessarily want to set up shop on their own, but who might want to look at other formal venues of employment. Now this is the program, and we'll see how it has worked. So the data that I have for you is dated in the sense that this was something we did last year, but given, I mean, you'll see that it's unlikely that very much has happened since either. The only thing that has happened, and which I think Waterade also spoke about, is that there is a fresh survey that is now happening, because the scheme was supposed to not have done what it was meant to do, and that survey is currently ongoing. So we'll see what comes from that. But this is what had happened to it 4 years after its inception. This was the first thing that we spoke about, fund allocations. Now, it's important to understand the difference between allocations and budget estimates and releases, etc., etc. Allocation is essentially what the government of India, and this is a central sector scheme, which is to say that it's 100% funded by the government of India. States don't contribute anything. The allocations that we are referring to here are essentially allocations made by the government of India under this program to the Ministry of Social Justice and Empowerment. It started with about 20 crores in 2012-13, jumped up to 70, 47, 555, and then 20. But here's the catch. This is only a part of the story. What happens to the allocations essentially is they start off as something known as a budget estimate when the budget is first prepared. At the end of the year, they're revised to include whatever changes have been made through the year, and the actual expenditure on the program only comes out a couple of years later. So where you see that you had budget allocations or budget estimates starting with 98 crores, going up to 557 crores, going down to 439, 461 crores, this was on paper. By the time the budget was revised in the same year, those allocations had come down to about a tenth, and the actual expenditure incurred by the government of India in the last 3 years was zero. Which is to say that no money was spent by the government of India on this program in the last 3 years. Why did they not spend it? This question was raised in the parliament. The Honourable Minister said that this money is not required simply because the organisation which actually deals with this, the NSKFDC, which is a sort of not-for-profit fund which is set up by the Government of India, already has sufficient resources. When this statement was made, the balance sheet of NSKFDC had 36 crore rupees to rehabilitate all the manual scavengers in the country. That's probably a tenth of what is being spent on the Gandhi Jayanti celebrations. Expenditure on this is basically this is actually the previous SRMS. They had claimed to have rehabilitated about 77,000 manual scavengers at that point before the scheme was revamped and expanded. But even then, you will find that most of the larger states, for instance, Tamil Nadu had managed to, among the identified, forget the people who haven't been identified, among those identified, about 33% were given any sort of compensation by Tamil Nadu, Uttar Pradesh 16%, Karnataka 13%, Madhya Pradesh. These are massive states which have big problems with this issue, and they had done very little by that time. This led to the revision. Now, the first problem that came up after this revision was who and how do we identify manual scavengers? We can only give them things if we know who they are or if they come forward to take them. In 2011, I think Manish and other people spoke about it. In 2011, there were about 26 lakh in sanitary latrines across the country. One would imagine that there would be some number of people who cater to these latrines. Even the SECC, which is the Socio-economic Caste Census, had found about 1.5 lakh, 1,68,000 manual scavenging households across the country. These are households, not necessarily individuals. There might be more individuals, but about 1.5 lakh households. When the states actually conducted their so-called surveys, they could identify about 13,465 manual scavengers by December of last year. That number has apparently gone up to about 50,000. We don't know the final number. We'll find out eventually. But right now, as things stand on paper, there's about 13,000 manual scavengers which the government claims exist across the country. They're supposed to each be given about 40,000 rupees, and many states haven't even managed to do that. Now, when we talk about government programs and government schemes, there are different kind of sort of governance mechanisms. There are some which are simple transfers of cash. This is the simplest form of government benefit. There are others which are service-oriented, service delivery-oriented. There are others which require multiple points of contact and interaction between, and each of them has a different dynamic. The simplest, of course, being paisa de do. You give them 40,000 rupees. They haven't seemed to be doing, they haven't seemed to manage, and at the same time, the OTCA disbursement, despite the pendency, is going down, which is to say that the people who have been left out are probably not going to see that money. There is, of course, a low uptake even on the self-employment credit, the so-called loans. And there are many reasons, sociological, economic, others, etc. But the simple fact remains that very few people actually have given. There was about 1,233 self-employment projects which had been sanctioned. So across the country, about 1,200 odd projects were being given a loan. Now, part of that loan goes as a subsidy, and so therefore you will see that there is a difference between the proportion of sort of loans given by a particular state versus subsidies given by a particular state. The subsidy is important because the subsidy is dependent on the project and the sort of ability of the person to repay that loan to actually set up that particular project. So when you say that the subsidy is low, what this means is that the self-employment projects are not going anywhere. You're getting a loan and the repayment is low, there is no sort of generation of employment or generation of revenue from it, and therefore there is no subsidy being given. That is a problem. Even on the third front, which is to simply train these people or their dependents so that they can actually do something other than manual scavenging, Punjab has done this for 380% of the people identified within the state, which is to say that all dependents can get it. And so therefore, if there is a particular family where there is a manual scavenger and no other occupation is being followed, then he might have 4 children, all of those 4 can be trained, and therefore it can be about 4 to 500%. Punjab seems to have done that, Madhya Pradesh seems to have done that, but across most of the other states, they haven't even managed to train a single person within the households that they have identified. And these are not large numbers. These are about 100, 200, maybe 500 somewhere, 50 somewhere else, and they simply haven't done it. There had been about 13,587 beneficiary training sanctioned by December of last year. Why is all this a problem? That the fact that this so-called scheme for rehabilitation of manual scavengers isn't working, and Dalberg had some sort of an estimate on how many manual scavengers or what type of manual scavengers would remain. Other people made an estimate as well. I don't really have an estimate, but I do have a problem. My problem is that I actually did a small survey in Udaipur last year, where we were trying to understand the so-called ODF panchayats, which became ODF subsequent to the launch of SBM. Now, if you see that in most of these cases, and these are all people who had toilets, they were either septic tanks, or what they call septic tanks, simply because they don't know a better word for it, and single pits. In a sample of about 550 households, we had 3 twin pit toilets, which are apparently what the SBM does in order to improve the situation of manual scavengers. When we asked these people as to how they would go about cleaning or emptying these pits when they are filled, about 86% said that they would call somebody to do it, and which is really a euphemism for saying that a manual scavenger, because there is nobody else to call. Who would you call? 5% would simply say that they would just go back and defecate in the open, hell with the toilet. 1%, I don't know who this gentleman is, but he said that he would clean it on his own, and some of them just simply didn't give a response. Now, if this is the situation, and this is also something, for instance, that the National NARS, the Rural Sanitation Survey, has found that about 70-odd%, a little more than that, in fact, are either septic tanks, single pits, with or without soak pits. These are toilets which will need cleaning in about 4 to 5 years' time. And there will be nobody to clean them except for manual scavengers. Now, you can give them 40,000 rupees if you can, but that's not going to change the fact that there will be more manual scavengers needed soon, and there is simply no other thing, no other way that you can actually rehabilitate them. Now, we are also trying to understand this is absurd. Why have we been able to find only 13,000 people when clearly you walk into any village, you can find a manual scavenger? It's really not that difficult, trust me. Now, one problem is, of course, identification. One is inclusionary identification. Who do you include? How do you include them? One is, of course, exclusionary identification. Who do you leave out of it? Now, the SRMS works on what is the self-identification model, in the sense that they set up camps, and then people are supposed to go there and say that I am a manual scavenger, and please help me. Now, there are problems with this. One, because nobody seems to be aware that there are such camps. Two, because how do you go and identify yourself, right? They ask you, for instance, for an Aadhaar, for a bank account, and for some sort of written proof that you are indeed a manual scavenger. Now, I am not really certain of which authority in India actually issues these kind of certificates, but I'm sure there is one. And then what does happen after that? What happens after you get these benefits? What happens when your self-employment projects don't work? What happens, or how does this interaction operate? Because you must remember that the administrative will is completely missing. The people who are supposed to be rehabilitating manual scavengers are infected by the same prejudice that is the problem in the first place. And so therefore, how do you break through and pass that to actually get the benefits to these people in a more sustainable or a meaningful manner? We don't know, but we're trying to understand all of these things in a study that we're just sort of starting with the Safai Karmachari Andolan. Hopefully in a few months' time we'll have some answers. But at the moment we have many, many questions, and all of them are actually quite significant. Thank you.
Thank you very much for this lively but very gloomy presentation in many ways. And I think we will end with, yes, exactly, with Nilanjana Bhattacharjee, who talk about women, right? Specifically the subject of women in sanitary work.
Women sanitation workers.
Women sanitation workers.
So actually,
So that's a good ending.
While this is being set up, let me just give a quick introduction. Hi, I'm Nilanjana. I work at Priya, and my colleague Shashi Shikha is there, and we both co-led a study on women sanitation workers, which was a phenomenological state-level study across Jhansi, Ajmer, and Muzaffarpur. We covered a total of 206 women, and the idea was to sort of expand the conversation and the debate on sanitation workers, which is restricted to A, very conservative numbers, as we've all gathered, B, statistics, C, schemes, but where are the narratives, where are the lived experiences? So while today I'll be presenting the dominant salient sort of result areas or findings from the study, I hope that you can go back and read our various knowledge products in the form of reports as well as films, which are a much more creatively curated version of the lived experiences, because all the findings that I'll be sharing with you today come from stories. There are 206 stories, and from 206 stories about everything under the sun, about the lives of these women, we called out various aspects which were important to policy advocacy. So I can truly steal from all the presentations. So I'm not going to expand on much of it, which is, as already we've established, Dalberg's presentation also established that about 1.1 million sanitation workers who are keeping the urban cities in India clean. Half of them are women, and while the census doesn't categorically disaggregate the data, the members from Dalit communities working as sanitation workers in India are about 13 lakhs. As Tripti already mentioned, every state and every city has its own history with the Dalit community. Based on that, there are multiple different names, be it Dom, Mehtar, Basti, Bhangi. There are various other very, very sort of rude names that are used as well on a daily basis. Yeah, so according to the Ministry of Social Justice and Empowerment's report in 2009, their annual report, there were about 7,70,000 manual scavengers and their dependents in India. Now, out of this, the highest number of manual scavengers belong to Uttar Pradesh. And out of this, about 4,20,000 manual scavengers have been assisted under the National Scheme of Liberation and Rehabilitation of Scavengers, and therefore they can no longer ask for any other assistance. Just a little over 3,40,000 remain to be rehabilitated. Now, another fresh survey sort of talks about, by the MSJE, in 2014 and 17 identifies nearly 13,770 manual scavengers, and an even more recent report, which hasn't been published yet, by MSJE, that counts data until June 2018, says that we have around 53,000 manual scavengers. This, as we all know, along with the 22,000 deaths per year, are all very conservative estimates. In fact, in this particular fresh survey by MSJE, only 121 districts out of 600 districts participated. In fact, this did not include the sewer and septic tank workers or the Indian Railway, which happens to be the biggest employer of manual scavengers in India. And many states didn't participate in this at all, saying that we don't have any manual scavengers in our sort of cities. It's also important to note that the children of sanitation workers are constantly either skipping out of school, missing school, or just dropping out completely to take up informal jobs and sort of help their parents to earn money. And while SBM has created over 1 million direct jobs, there is a severe need for a comprehensive, exclusive policy that looks into sanitation workers of different types, be it community toilet and public toilet cleaners, STP operators, or desludging operators. So now I'm going to move on to the 4 most salient findings from our study. This is a color-coded comparison of the 3 cities, Jhansi, Ajmer, and Muzaffarpur. Green is all 3 cities, blue is Muzaffarpur, red is Ajmer, black is Jhansi. Now we looked at three types of sanitation workers: permanent, contractual, and outsourced staff. When you look at these three types exist in Jhansi, however in Ajmer and Muzaffarpur we only have permanent and contractual workers. When you look at the permanent staff, they dominantly enjoy the perks of a formal employment, be it in terms of their salary, which is a very decent salary between 25 and 30,000, to EPFs, paid casual and earned leaves, maternity leaves, pension contribution, insurance, and death claim, which already, as has been mentioned, is one of the most important sources of security for sanitation workers to be able to pass on their jobs. When you move on to contractual staff, barring Jhansi, the only entitlement that sanitation workers in Ajmer and Muzaffarpur get is 5,000 rupees a month in Ajmer and 8,000 rupees a month in Muzaffarpur. In Jhansi, the situation is relatively better off, where these contractual workers get EPF, they get this thing called the society fund, they get 15,000 rupees a month, and they get paid maternity leave and casual leaves. As you move on to the outsourced workers, which is unique to Jhansi, the only perk that they get is very similar to the contractual workers in Ajmer and Muzaffarpur, which is 7,000 rupees a month. Now this is extremely disturbing because more than 75% of the women who participated in our study and generally work in the sanitation value chain are contractual workers. And it was also realized that during the months that have the 31st day, the 31st day is essentially a day where you take your labor, but you don't get paid for it. So not only do contractual or outsourced workers not have paid holidays, they also give unpaid labor on the 31st day of every other month. There is absolutely no unionization. The only need for women sanitation workers in the scope of unions is to show number and is to show crowd. The job situation, as already discussed about in terms of the contractual aspect of employment, is extremely insecure. It's a very hire and fire culture, so nobody speaks up. And our film also shows these multiple narratives where basically if you say no, there are 5 other people to take your job. So nobody's gonna, revolt. The contracts are extremely disabling, and what was very disturbing is that across the 3 cities and across all 3 kinds of workers, barring 2 permanent employees in Ajmer, nobody's ever received a payslip in their entire sort of work life, which is like more than 20-25 years. This is a direct violation of the Minimum Wages Act. And furthermore, the money or the salary for contractual workers and outsourced workers is in compliance with the Minimum Wages Act. Whereas the work of sanitation very much is a skilled job. To be able to identify the different kinds of waste, its handling, its treatment, and its disposal is very much a technical aspect. So a lot of the conversation about the occupational health of sanitation workers is revolved around the physical aspect. However, when we talk about centuries of caste-based discrimination and this entire concept of manual scavengers under the ambit of sanitation workers, the fact is that the narrative has dominantly also been of communal trauma. So in terms of their mental health, in terms of the emotional health of an entire society, of an entire community that has been suffering for so many years, it's very important to take that into your aspect when looking at their health, when looking at their occupational health. So in terms of physical occupational health, none of the women had ever received any protective gears. The only time they did receive it is when VIPs visit the city and it's all a farce and it's taken back from you. Even if they did receive it, 5 years ago, 3 of the sanitation workers mentioned that the quality of these particular equipment was so terrible that they were far more disabling in nature than enabling. None of these women have ever received any vaccinations despite the dangerous nature of their job. They've never received formal training before starting their job. Everything has been learnt on the job. There are absolutely no first aid kits available at the workplace, despite the fact that they all handle non-segregated waste, which are an accumulation of various kinds of syringes, broken crockery, glasses, everything. And there is no blanket medical insurance. No workplace almost, very limited workplaces in the formal sector in itself recognize the question of a woman's body when she takes her labor to work. So this is even worse off for women sanitation workers who said that during menstruation, the physicality, the strenuous physicality of their jobs is something that is constantly coinciding with their menstrual cycle once a month. These women said that, imagine having a job where there are 3 to 4 really hot months in the year. So imagine having a job where you're guaranteed burning thigh rashes for 4 months in a year, and you have to walk under the sun, under the scorching sun. You have to walk for miles. You have to carry these really heavy thalas to be able to dispose of the waste. And you've just got to do it. It's a part of your job. 6 out of 10 women experience different kinds of eye, skin, and throat infections, especially during the monsoon. As Tripti already mentioned, they carry their taslas, which they carry over their heads, and as it rains, the water sort of pours down with all the other dirty things sort of into their bodies, which is a immediate recipe to infections and diseases. And therefore, all of this compounded together also sort of feeds into a severe lack of dignity, a sense of stress, depression, anxiety, and humiliation, and also leads to and is also influenced by substance abuse in the community, where most of the men are drunkards, they're addicted to alcohol, and women have to constantly chew tobacco or gutka to be able to bear the stench of their work. My colleague later will be talking about the different kinds of acts and stakeholder mapping in place to directly cater to sanitation workers, and yet more than 95% of these women had absolutely no knowledge about laws, policies, programs that have been put in place to protect them. More than 70% of these women were illiterate, and more than 95 belong to Mahadalit or Dalit castes and have been formally in this job for more than 4 generations. Before that, there were various other kinds of patron-client systems, such as in Jhansi, such as in Ajmer, the Rani system, which are ancient systems of patron and client sort of relationships. And in all the 3 cities, there have been absolutely no attempts whatsoever by any elected representatives, any sort of party or any local leader to disseminate information, raise awareness about their rights and responsibilities, or sensitize the citizens about how to be responsible and make the lives and work of sanitation workers easier. And I'm going to wrap this up with my last and final finding, which is sort of wrapped around every other aspect and every other nuance that we found through the study, which is the lack of dignity or agency. Sanitation work is looked at as an unskilled and informal job. It is minimally supported with regulatory framework to the point where even permanent women sanitation workers who've been working for over 20 years have never received any promotion, despite their male counterparts getting promotions and sort of being promoted to supervisory positions. Sanitation workers experience touch-based discrimination on a daily basis, be it in terms of local transport, be it in terms of public spaces, be it in terms of general attitude and behavior. So you're looking at an entire community dealing with the question of agency versus access. So even if you have a stakeholder map or sort of programs and policies and acts in place, the provision or the availability of these does not ensure its access, just like creating toilets doesn't mean its usage. We're dealing with a community where even 10th pass, 12th pass, and those with sort of diplomas don't end up. That's fine. That's fine. Despite sort of being 10th or 12th grade pass, the students of Valmiki communities don't get jobs at other places. And one final finding, which was very important to our study, we thought, is that there is immense internal political dynamics within the sanitation community. So what we've constantly been talking about has been dominated by sources of external limitations, such as education, such as discrimination from the outside society. But there also exists an immense amount of discrimination within the society, where there is a strange sense of loyalty, where basically if you move ahead, you have to either move ahead taking everyone along, or you don't move ahead at all. Number 2, despite wanting to move beyond this caste-based barrier, you have 30 seconds. Okay. Despite wanting to move ahead of this caste-based barrier, there's still resistance in giving away their jobs to other people, because the various mechanisms just become another way of being exploitative towards the sanitation workers community. So with that, I'm going to end this conversation, but I'm going to insist that I think along with the debate, we need to bring in a new aspect, which is not just looking at what are the external sources of limitations, but what are the internal sources of limitations, because I think that would add a lot more fabric to the debate, and it's important to sort of talk about. So yeah, thank you.